10 top breastfeeding challenges and 3 tips on nursing a baby long-term. Breastfeeding can be a rewarding experience for both mothers and babies, but it can also present its own set of challenges. Here are 10 common breastfeeding challenges, along with 3 solutions. Latch difficulties. A poor latch can make the mother uncomfortable and result in the baby not getting enough milk. The baby's mouth should be open widely and their chin should be touching your breast for a successful latch. To determine what works best for you, you can also experiment with various nursing positions, such as the football hold and the cross-cradle hold. Painful breastfeeding. While breastfeeding shouldn't hurt, it can occasionally be uncomfortable. Try massaging your breasts before breastfeeding or applying a warm compress to your breasts before nursing to lessen discomfort. To assist the infant in latching onto your breast, you can also use a nipple shield or a lactation aid. Insufficient milk supply. Mothers frequently worry about their milk supply, particularly if they are not producing enough to meet their baby's needs. If you want to increase your milk supply, try nursing more frequently, pumping in between feedings, and making sure the baby is latching on correctly. To increase your milk production, you can also try consuming lactogenic foods and supplements. Engorgement. Engorgement is when the breasts swell up and become full of milk. It frequently happens in the first few days following childbirth. In order to reduce engorgement, try nursing frequently and applying a cold compress to your breasts in between feedings. To ease the pressure before nursing, you can also try expressing a small amount of milk. Mastitis. A breast infection known as mastitis can result in breast pain, swelling, and redness. Be sure to nurse frequently and completely empty your breasts to avoid developing mastitis. If you do get mastitis, you can try taking a warm shower or applying a warm compress to the breast that is affected to help with the pain. In order to treat the infection, you might also need to take antibiotics. Clogged milk ducts. A firm, uncomfortable lump in the breast may result from clogged milk ducts. Try nursing frequently and warming up the affected breast with a compress before nursing to prevent clogged ducts. While pumping or nursing, you might also try gently massaging the lump to aid in clearing the obstruction. Low milk supply due to medical conditions. Milk production can be impacted by a number of illnesses, including thyroid issues or hormonal imbalances. Discuss treatment options with your healthcare provider if you believe a medical issue is the root of your low milk supply. Breastfeeding in public. Breastfeeding in public may cause some mothers to feel uncomfortable, but it is a normal and essential part of raising a baby. If breastfeeding in public makes you feel uncomfortable, consider using a nursing cover or finding a private space. Keep in mind that it is generally legal for women to breastfeed in public. Going back to work. After giving birth, going back to work can be a difficult transition, especially if you are breastfeeding. Consider pumping and storing breast milk before going back to work and finding a private space at work to pump in order to ease the transition. Additionally, you can discuss scheduling flexibility or taking breaks to breastfeed with your employer. Weaning. Making the choice of when and how to wean your baby from breastfeeding can be challenging. There is no right time to wean your child. Breastfeeding is a decision that only you can make. If you do decide to wean your baby, consider doing it gradually so that they can get used to drinking from a bottle or cup. Here are 3 tips for nursing a baby long-term. Find a comfortable nursing position. The experience of breastfeeding can be improved for both you and your baby by finding a comfortable nursing position. The football hold, the cross-cradle hold, and the side-lying position are some typical nursing positions. Find the one that is most comfortable for you and your baby by experimenting with various positions. Keep yourself and your baby hydrated. It's important to stay hydrated by drinking lots of fluids because breastfeeding can be physically taxing. In addition to breast milk, give your baby a bottle or cup of water to ensure that they are getting enough fluids. Seek support. Having support from others can be beneficial because breastfeeding can be difficult at times. Think about joining a breastfeeding support group or getting in touch with other mothers who are breastfeeding to get advice and support. For assistance with any breastfeeding-related problems, you can also speak with a lactation consultant or a medical professional. If you enjoy our content and want to see more, please please consider subscribing to our channel. We regularly post new videos and would love to have you join our community. Thank you for your support.